The patient's really, really important. We also have to consider their families and their friends and their support network and the carers out there, because they're the people ultimately who bring them for their appointments, the people who look after them when they're at home and they're feeling sick, or they're having a bad day, or they need to be transported here, their blood test or whatever's happening. And so when we ask someone to participate in a clinical trial, we're putting a lot of extra burden on them and their families, and we understand that. So we really have to look at the whole situation. It's not just patients, it's everybody involved with that. Once upon a time, you just had where the doctor did the reporting on the patients and how they were feeling. Now we ask the patients to do their own reporting, and they actually fill out their surveys and their questionnaires, and they're able to provide us with how they're feeling. There's also ones that carers can fill out too, so we get that whole feeling of how everyone's coping with the situation and how we can play a big part in helping them get through things. If you're on a clinical trial, you're going to get expert care. If you're on that trial for 5 years or 10 years, you're going to come back and see that doctor initially, probably 4-5 times a year, if not more initially. And then as it progresses, less and less. But every time you're coming back, you're seeing that specialist, you're seeing the research nurse or the trial coordinator. You're having all of those tests done. They're keeping a really close eye on you, and you're being scrutinised. So you really have optimal care during that whole time that you're on a clinical trial. So really, I would say you're going to get better care than if you weren't on a clinical trial, because you're always coming back for those visits. You're getting phone calls saying, hi, how are you going? So you're getting opportunity to go, oh, I haven't been feeling well or whatever, and people are monitoring you the whole time, and that's really important.